I'm going to be inserting a nasogastric tube into a patient. I would walk in the room, introduce myself to the patient, explain the procedure, review medication history or medical history for any facial surgeries. I would assess the abdomen and the nares for patency or breakdown. I would perform hand hygiene, put my gloves on, and provide for privacy. I would position the patient in a high Fowler's position, and I would establish a stop signal. Then I would gather my equipment. Okay. And I would measure, I would put something over them like a towel or something. And then I would measure the tube from the ear to the nose down to the xiphoid process. And I would go ahead and mark the tube. Before inserting it, I would have them tilt their head back and tell me when they're uncomfortable. So I would insert the tube and I would tell them to swallow while inserting it 2.5 to 5 centimeters in. And then when I get to the pharynx, I would have them lean their head forward a little bit, and I would keep inserting until I reach the stomach. And then I would stop and I would mark my tube, and then I would measure the rest of the length of the tube. To check placement of the tube, I would take the patient to x-ray, or I would measure the pH. For the lungs and the intestines, it would be around 6, and for the stomach, it would be 4. And I would observe the characteristics, and then I would tape the tubing to secure it to the patient. Okay. And then I would clamp the tube and remove the syringe, and then I would clamp it, or I would plug it or attach it to the suction. And then I would remove my equipment from the patient. And I would also, before inserting the tube, I would lubricate it. And then I would remove my gloves, perform hand hygiene, and make sure the patient's comfortable, observe for signs of respiratory distress. If the patient's okay, I would give them their call light and document.